Hello everyone, my name is Ebun and welcome to Mental Health Awareness Week. I'm a clinical pharmacist and I'm also an independent prescriber. I've worked in multiple sectors of pharmacy, including mental health, and I currently work with GP practices all over the UK, consulting them on medication management. So I'll be speaking about anxiety and the effects of the body, also some medication management that can be used with anxiety. So what is anxiety? It's actually a feeling of unease or worry. It can be mild or severe. However, it's actually a natural process of the body and it's the body's way of protecting us from a perceived threat. So during the perceived threats or fear, for example, something called a fight or flight response is produced and certain hormones such as adrenaline and cortisol are produced. So what do these hormones do? Well, for example, it increases heart rates and also breathing, meaning that there's more oxygen and blood that are sent to certain muscles of the body. Also, we sweat more, so we don't get too hot. We feel more alert and awake. And also, there are some pain relieving properties during that process. So anybody can actually feel anxiety. For example, an athlete before a race would have to feel a certain level of anxiety to help them get more oxygen and blood to the muscles so they can run faster. And also somebody who's about to go on holiday, for example, or sit an exam will feel certain anxiety and will feel anxious. That helps them to feel more alert and to also protect them from the perceived threat, for example. So there are some treatments for anxiety. I'll start with the non-medical treatments first. Things like relaxation therapy are known to help with anxiety. Also cognitive behavioral therapy, things like art therapy also help, and certain herbs such as lavender, passion flower, and chamomile have been shown to help with anxiety. However, it's also important that if you do feel anxious, reducing certain things in your diet, such as alcohol, nicotine, sugar, caffeine, are very important because they can increase the stress hormone cortisol, which makes you anxious. Now, onto medical treatments. So there's no set in stone treatment for anxiety. However, certain antidepressants are used. For example, sertraline. They increase the level of serotonin in your body, and that has an overall effect improving the mood. Also, medications like benzodiazepines, such as diazepam, are used. So they're not for long-term treatments. However, they are useful in the short-term treatment of anxiety. For example, if you're about to go on a flight and you get nervous, you can be prescribed diazepam just before the flight that will help to calm those nerves. Other medications such as beta blockers can be used. Now, what these do is they slow down your heart rate. So if you feel anxious, you can take the beta blockers and they just help to calm down. Again, that's not a long-term treatment. It's used when required for anxiety. So it's very important before you start any medication to always speak to a healthcare professional because everybody has different reactions to medication and everybody has different needs. In conclusion, anybody can feel anxious. However, it becomes a disorder when it starts to affect your everyday activities. So if you are experiencing any forms of anxiety, please do speak to your healthcare professional. Thank you for watching.